Welcome to the deep dive. Today, we're exploring this really powerful combination, aren't we? Blockchain and AI in healthcare.
Absolutely. And you shared some, well, quite compelling sources about how they could really change things up in medical data management.
Yeah, exact. So our mission really is to dig into those key benefits, the potential, but also, be realistic about the challenges, the complexities involved.
Definitely. So where should we start? Maybe with the basics of blockchain in this context.
Good idea, how it's fundamentally different from, say, traditional databases.
Right. So, traditional systems are usually centralized, one main database. Blockchain, on the other hand, is distributed across a network.
And that decentralization is a huge plus, isn't it?
Yeah.
Especially when you think about cybersecurity threats.
Oh, for sure. Centralized data is a big target. We see attacks, ransomware, huge costs from data breaches in healthcare, even attacks on biotech R&D.
So blockchain security comes from being spread out and the crypto stuff.
Uh-huh. Cryptographic hashing. It basically links blocks of data together in a chain, making it secure and, well, immutable. Tamper-proof, essentially.
Which builds trust, right?
Right.
Because you have this reliable, unchangeable record, great for audits, assuming you have the right permissions to see it, of course.
Exactly. Now, traditional databases, they're often faster for day-to-day transactions, maybe more flexible if you need to change data easily.
But they lack that built-in trust layer against manipulation.
Yeah.
It really boils down to control, doesn't it? Centralized versus distributed.
Which leads us nicely into this idea of data sovereignty and self-sovereign identity, or SSI.
Right, SSI. This seems like a potential game changer for patients. Tell us more.
Well, think about your health records now. They're probably scattered across different doctors, hospitals, labs, and you don't really control who accesses what.
Yeah, it's a mess sometimes. And you feel a bit powerless.
SSI aims to fix that. It's a paradigm shift, really, giving control of your digital identity, your personal data, back to you, the individual.
Okay, how does that actually work? What are the components?
So you have things like decentralized identifiers, DDIDs. Think of them as unique digital addresses you control, anchored on a verifiable data registry, often a blockchain.
Like Hyperledger Indy or Oracle's platform? Those are examples.
Yeah, those can act as the VDR, the trust anchor. Then you have verifiable credentials, VCs. These are like digital versions of your paper records, test results, diagnoses issued by trusted places like hospitals or labs.
And where do these VCs live?
In your digital wallet, on your phone or device, securely stored, along with your DDIDs and the private keys you need to control them.
So I hold the keys, I hold the credentials, and I decide who gets to see them.
Precisely. You get granular control. The VDR helps others verify that your credentials are valid without needing to ping the original hospital every single time.
That sounds really empowering. Better privacy, easier, more secure sharing when I want to share. Could really help with interoperability, too.
Definitely major benefits. But there are challenges, of course. You become responsible for securing your keys and credentials.
Right. Lose your keys, lose access. We need really user-friendly wallets with good backup or recovery options.
Absolutely. And critically, the sensitive health data itself, the content of those VCs, isn't usually stored directly on the main blockchain.
Why not?
Well, scalability issues, cost, and also privacy regulations like GDPR. You don't want sensitive health details publicly visible, even pseudonymously.
So where does it go?
It's typically encrypted and stored off-chain, maybe in your wallet, maybe encrypted cloud storage. The blockchain just verifies the metadata, the proof of existence, and validity.
Okay, that makes sense. Let's shift slightly to data integrity overall, beyond just identity.
Right. Traditional systems, they can be prone to errors, accidental, or even malicious changes over time. Hard to track sometimes.
But blockchain gives you that immutable, tamper-evident history we talked about.
Exactly. It creates a trusted log of everything that's happened to the data after it's recorded. Fantastic for audit trails, ensuring clinical trial data hasn't been messed with, or tracking pharmaceuticals through the supply chain.
So you can trust the record is as it was originally entered.
Yes. And again, often it's a hybrid model. You store a cryptographic hash like a digital fingerprint of the health data on the blockchain.
But the actual data stays off-chain encrypted, maybe using something like IPFS.
Yeah, IPFS is one option for decentralized storage. The hash on-chain proves the off-chain data hasn't been altered since it was hashed.
This brings up a potential conflict, though. Blockchain's immutability versus rules like GDPR that give people the right to correct or erase their data. How does that work?
That's a really important point and a tricky one. The off-chain storage approach helps a lot here.
How so?
If the data is encrypted off-chain and the access key is managed via the blockchain, Deleting or revoking the key makes the data effectively inaccessible even if the hash remains. It's like locking a door and throwing away the key.
So you achieve a sort of erasure without actually altering the historical chain.
Kinda, it's one practical solution. There's also research into redactable or editable blockchains, but that's more complex.
And we have to remember, blockchain only guarantees integrity after the data is on the chain. Garbage in, garbage out still applies,
It's
right?
absolutely crucial point. You need strong validation before anything gets recorded onto the blockchain. Its magic doesn't fix inaccurate initial data entry.
Okay, so wrapping this up, blockchain and SSI really do propose a fundamental shift, moving control of health data towards the individual.
Right. And when you combine that with the growing need for secure, private AI in healthcare, well, it prompts a big question.
So for you, the listener, considering this potential shift in data control and the rise of AI, what do you think are the most significant societal changes we might see unfold as these technologies mature and maybe become part of our everyday medical lives? That's something to think about.